glucose becomes very toxic to various tissues. It damages the retina of eye, it damages the kidneys, it damages the liver, it causes and it induces the oxidative stress also. In type 2 diabetes, what happened here, the insulin is produced by the beta cells of the pancreas, but this insulin is not effective because its receptors are not working properly. It cannot bind with its receptors. So the receptors, if they are not responding to the insulin, so then also glucose level remains increased in blood. So this is called as the type 2 diabetes. It also gives rise to various types of pathological conditions. So, we have classified this diabetes mellitus, for example, type 1, which is associated with beta cell destruction, and it can occur in young age. So it is complete lack of the beta cells. The type 2 diabetes is beta cell dysfunction and insulin resistance. And gestational diabetes is beta cell dysfunction and insulin resistance during pregnancy. Other specific types of the genetic defects of beta cell function, exocrine pancreatic diseases, endocrinopathies, drug or chemical induced or other rare forms. So the main symptoms of the diabetes mellitus are, which are first symptoms, the polyuria, that means frequent urination, and polydipsia, when a person is going for frequent urination or polyuria. So it needs the body fluids are released in excess quantities from the body. So it needs now the body fluids. So the thirst center of the brain is activated. So it feels thirst. That condition is called as polydipsia. So excessive thirst. And number third symptom is the polyphagia, that is excessive hunger. These are the main three symptoms related to diabetes mellitus. So the polyuria is when the uptake of glucose by the extracellular or the extrahepatic tissue is decreased. The utilization of glucose is also decreased, and then increased production of glucose occurs. And these three conditions, they give rise to blood glucose level, which is called as hyperglycemia. Then blood level of glucose when crosses the renal threshold, this glucose appears into the urine, and through urine, when glucose is passed through the urine, that condition is called as glycosuria. So glucose is osmotically active, and when it enters into the tubules of the kidneys, it is osmotically active. The more fluids are released from our urine volume is increased, because there does not occur the reabsorption of water from the tubules or the collecting duct, because it contains the sugar, and due to the osmosis, the large number of or the large volume of this water is released in the form of the urine, which gives rise to the polyuria. So excessive loss of water due to this polyuria, then osmolality of the blood increases, and it stimulates the thirst center of the brain or the hypothalamus, and you feel the patient feels thirsty, and that condition is called as polydipsia. And we have different types of diabetes, like diabetes type 1 diabetes mellitus and type 2 diabetes mellitus, gestational diabetes. Other new types of diabetes, one is called as LADA, which is called as latent autoimmune diabetes in adults. What happened here? The antibodies of a patient or young adults, they encounter onto the beta cells, and they damage the beta cells. MODY is the majority onset diabetes of the youth and or the young. The secondary diabetes mellitus. These are some of the types of diabetes mellitus which we are going to study one by one here. So around 10% of all the people with diabetes have type 1 diabetes, and there are several markers of this autoimmune destruction detectable in the body fluids and the tissues, like islet cell autoantibodies of insulin, autoantibodies of glutamic acid decarboxylase, and the autoantibodies to the tyrosine phosphatase. So, type 2 diabetes mellitus was formerly known as the non-insulin dependent diabetes mellitus, or type 2 or adult onset diabetes. It is much more common than that of the type 1. Type 1 occurs in young age, but type 2 occurs in old age. So type and comprises approximately of 90% of the individuals with diabetes. So this begins with insulin resistance, this which is a condition in which the cells fail to respond to insulin properly and causing higher blood sugar levels. And type 2 diabetes is most commonly diagnosed in older adults, but is increasingly seen in children, adolescents, and younger adults due to rising level of obesity, physical inactivity, and poor diet. So type 1, I have told you in previous slide, and type 2 means was this. Now look at here. So this shows the type 1 diabetes where there is insufficient insulin. That means the beta cells have been destroyed by um, the autoimmune system or the antibodies, or due to virus infection or due to drugs. So these diminish insulin, and when insulin is diminished, and here occurs the increase in the blood glucose, and this when insulin is present in negligible amount, so some of the receptors can be activated by the insulin, but the most of the receptors, they remain empty, so the less amount of glucose is stored into the liver, into the muscles, or into the adipose tissues, or into the target organs of this insulin. In type 2 diabetes, insulin resistance, the insulin is present here. You can see here the purple color triangles, which shows here the insulin is present, but they cannot, the receptors are not responding to the particular insulin. So that is called as type 2 diabetes. So hello, am I audible? Yunus?
Yes, sir. Please